Guys, let's talk about tension pneumothorax today. And before we can talk about tension pneumothorax, we need to understand pneumothorax. When we talk about pneumothorax, we are talking about accumulation of air in the pleural space. Someone might ask, what is the pleural space? The pleural space is a space that occupies your lungs. It contains just some little amount of fluid that allows your lungs to expand and contract. So that space that cage your lungs, that enables it to be able to expand and contract, because for you to breathe in and breathe out, your lungs expand and contract. So that lungs need a space to be able to expand to accommodate the incoming air and contract to be able to release the carbon dioxide. Do you understand? And so if there's no space, how can your lungs be able to expand? So that particular space is called pleural space. Do you understand? And so it contains just little amount of fluid to allow your lungs to be able to swim around. To be able to expand and contract. But in a situation where air finds its way there, when there's air inside that space, that air is called pneumothorax. It gives you a condition called pneumothorax. Do you understand? Now, when we talk about pneumothorax, there are different types of pneumothorax. We have open pneumothorax. Maybe you have a traumatic event. Maybe there's a gunshot into your lungs or into your chest, or there's a sharp knife that pierced through to your chest. It creates a hole into your chest. That hole that has been created, air can rush into. And when air rush and get to the pleural space, that can give you what? Open pneumothorax. Or the lungs itself contains air. So if there's a trauma on your lungs itself and the air that is trapped in the lungs begin to leak out into the pleural space, that one too is also classified as what? Closed pneumothorax. Then when we talk about tension pneumothorax, which is another type, there are other types, but we want to focus on tension pneumothorax. Tension pneumothorax is a situation whereby there's air trapped at the pleural space and that air cannot escape. When the air trap get into the pleural space and get trapped and building pressure and cannot escape, that one is called tension pneumothorax. And it is a severe medical emergency that needs an immediate care. If not, the patient can just get unalived. Do you understand? So if air finds itself into the pleural space and get trapped and cannot escape, and then exerting pressure on your lungs, that's what we call tension pneumothorax. Do you understand? Good. So when someone is having tension pneumothorax, there are certain signs and symptoms the person will exhibit to show that he has tension pneumothorax. One of the signs and symptoms is hypotension. Do you understand? When the air that is built up in the pleural space and now exert pressure on the lungs, that exertion can get to your heart, and your heart will find it difficult to pump, and that can lead to what? Hypotension. You can also get what? There's absent breath sound. When you want to listen to the breath sound with your stethoscope, you will not get what? Breath sound, especially the affected site. And the patient will also experience what? Respiratory what? Distress. The patient can also have what? Tachycardia. There are also signs of shock. And then one of the classical signs and symptoms is a distended neck veins. Distended neck veins. Your veins that carry venous blood that's supposed to return to your heart now will get stuck because there's a pressure exerting even on those veins. And so when the blood is returning, that blood can get trapped to the point that it cannot get to your lungs, and then it can accumulate and then distend your veins around the neck. And the late signs and symptoms that we usually have in this condition is tracheal deviation along the affected site. The patient trachea can be deviated along the affected site. That is some of the signs and symptoms that this patient is going to exhibit, including signs and symptoms of shock. Now, how do you manage this patient? Since it is a severe medical emergency and need an immediate attention, then what we need to do is first is needle decompression. The patient need what? A needle decompression. So we use a 14 to 16 gauge needle, and we pierce it into the patient's pleural space. These are the areas where we can pass the needle. Second intercostal space mid-clavicular, the mid-clavicular line, or fifth intercostal space anterior axillary line. These are the space where you can pass your needle. The needle gets into the pleural space, and then the air will pass through that. The air will come out. You see, it's like when a balloon is full of air and you want to deflate it, you push a needle into the balloon, and what happened? The air will just deflate out. That is the idea. So when you put the needle into the second or the fifth intercostal space, into the pleural space, then the air that is trapped there is just come out automatically. Number two, after the needle decompression, then you can insert a chest tube. What is the role of the chest tube? The chest tube will go into the pleural space and continue to drain gradually the remaining air that is trapped inside there. Then the lungs can now relax to be able to breathe normally, expand and contract normally. Apart from that, the patient will need an x-ray. When you put a chest tube into the patient, you will need an x-ray to actually find out whether the chest tube is at the right place. Do you understand? So this patient will need a chest tube. And another thing that the patient will need is supplemental oxygen. Because of this condition, I already mentioned some of the signs and symptoms like respiratory distress. So that means the patient oxygen level is going to be diminished. So this patient will need an oxygen administration. And the last thing you will give to this patient is supportive management and treatment based on presenting signs and symptoms. If the patient presents other signs and symptoms, then you treat as such. So this is the appropriate management: needle decompression, chest tube insertion, chest x-ray to ensure whether the chest tube is at the right place, then oxygen, supplemental oxygen, and supportive care to this patient. That is tension pneumothorax for you. Please follow me on YouTube at Emergency Nurse 011. Emergency Nurse 011. The link is on my bio. You can tap on the link. It will take you there. Thank you so much.